Hello and welcome to WJTS in.form. I'm your host, Bill Potter. There's a pilot program that has been started at the Southridge Middle School, put on by the Dubois County Public Health Partnership.
Correct.
Let's find out about that in this edition. Joining us in the studio is Donna Oeding. She is the director for the Dubois County Health Department. We also have with us Megan Durlauf, and Megan is the, I'm going to read this because I want to get this right, the treatment programs facilitator.
That is right.
For Dubois County? Mm-hmm. Okay. Donna, we'll start with you.
All right.
What is this pilot program? What's it about?
The partnership has looked at several different issues that we feel need to be addressed in the community, and one of the areas we had never looked at was the middle school population. And through some surveys that are always done in our schools, we have also just completed a survey of our adult population. We found that drug and alcohol use in our community is a concern. Luckily, with our partnership with the Purdue Extension Dubois County, they found a program that we are going to talk about today that was being used in Kentucky that creates scenarios for the students to go through that makes them, what are the consequences of their decisions on drug and alcohol use, and they'll get to meet with several of our community partners, and we can get into that in a little bit. But we know that the kids are starting to use drugs and alcohol way before they're 18 years old. So we know we need to get into the schools and try to create some kind of a level understanding of what the consequences of that use is.
Okay, and Southridge is where we're doing this program for 7th and 8th graders?
Just seventh grade.
Okay.
Southridge stepped forward and has been wonderful to work with. They are real excited about us bringing the program to them. The principal there, Al Mihalovitz, and his staff have been wonderful to work with, and we're real excited about the opportunity of working at Southridge and with their students.
And Megan, I'm assuming by your title, you see a lot of the unfortunate results of drug use at the correction center.
I do.
7th graders using drugs? Really?
Yeah, you know, whenever I talk to people, like clients, participants in our program, whenever they identify how old they were whenever they first started using, it usually is right around the middle school age. And, you know, the purpose for our involvement is the preventative measure so that we don't see them coming to us at the corrections facility down the road.
Because drug use, while it's bad in itself, leads to crime.
It absolutely does.
And you want to put yourself out of a job in a way, right? So that there's no need for what you
yes.
do.
Yes. Job security is not on my radar right now.
Okay.
That is, yeah.
What are you hoping that this program accomplishes? What are you hoping kids walk away going, I'm never going to use drugs, or what's the end result?
From my aspect, my end result would be never to see them in the system. But also just an educational standpoint of we want them to know the harms of it. And I think that that's where a lot of it comes in. Like, they want to use it, they want to try it. That's a child's natural instinct, is to experiment and try new things. However, if they understand and know the dangers of it and the consequences of those behaviors, then maybe they're more likely not to try in the first place.
What are we seeing? What sort of drugs, I guess, are being used by 7th graders, or possibly?
Right now, what we see a lot of is the synthetic marijuana, so like spice and K2. Okay. But then there's also the usual drinking alcohol and smoking marijuana. Some of the things that you would consider to be not as hard or heavy, however, still having long-term detrimental consequences.
Because they lead to other things.
Absolutely.
And the Public Health Partnership is a multitude of groups that come together.
Right. We have about 20 different partners that belong to this, and that ranges anywhere from all 4 of the school corporations. We have members of the government agencies from the county and the cities. We have a lot of the service organizations, such as Purdue Extension, TRICAP, the Tri-County YMCA, Crisis Connections, the Substance Abuse Council is partnering with us on this, and then many of our industries, such as Kimball, OFS, Wabash Valley Produce. It's just a real big group of public health system providers that want to work together to try to bring programs and educational information to the public on what a wide variety of different topics, this just being one, being how can we raise healthy children, but we want them to be well balanced, not just mentally, socially, and physically. So that's really the intent of the partnership.
Okay, and this program is a pilot program.
Absolutely.
Usually that means that you're hoping that it starts here and spreads to other places.
Right. We've done a lot of work developmentally. The committee has done a lot of work, Megan and her group coming up with the scenarios so that we can take this out into the other school corporations. They're really anxious. I think a lot of those school corporations are real anxious to see how this goes. And that is absolutely our intent with any of the projects that the partnership does, is when we pilot them, we don't want to start out too big. We want to make sure what we're doing is right, that it has that effect that we want, and then be able to make the necessary changes and take it out to the different other schools or other venues that we need to take it to.
What will happen with this program? Is it a class? Is it an hour in the health class? How is it being used at the school?
You want? It's really almost a whole afternoon project that we have, and if anybody is familiar with the reality store, and I think a lot of people have that concept in their mind, it's set up very similar to that, where we are breaking the kids into 9 different groups. I think there's something like 140 kids in 7th grade. We'll break them into 9 different groups. We'll have leaders with them, and they are given a scenario. Each of the groups will have a different scenario, and then they will visit the different community partners, whether they'll visit a CASA worker, whether they visit a probation officer, whether they actually see the sheriff, the judge. There's a wide variety of different people that we have that they will actually go and sit in front of and say, okay, this is what I did. Here's what I would tell you if you came to see me. So, and then they go through that, then we will bring the kids back together. We will let them talk it out and see how they responded to what the consequences of their actions are. And then to kind of wrap up the whole day, we're really fortunate that Kelly Craig Schaefer is going to be our guest speaker. And I think most local people know Kelly, and she was injured in a car accident several years ago as a result of a drunk driver. And her message is so powerful, and I think she will really reach the kids with, I'm living proof of the consequences of alcohol use.
Well, when we think of drugs, oftentimes I think we think of narcotics. But alcohol is a drug as well. Mm-hmm. You're doing scenarios. So these kids are put into situations that they may not normally get into, and they have to get out of it? Or did you create the scenarios? Give me an example.
Yeah, okay. I did. With a little bit of help from the University of Kentucky's program that they already had designed. They had some scenarios, but we had to tweak them to make them more applicable to the 7th graders, because this was originally developed for high schoolers. But an example of a scenario would be, my father gave me Xanax because I was nervous for my test that I'm going to take. I was telling this to a student in my classroom, and my teacher overheard me, who immediately took me to talk to a counselor. So from there, the student would immediately go speak with the counselor at the school, and then they would talk to somebody at Southern Hills, and then they would talk to a CASA worker, and then actually they would get to talk to a work release participant right now who may or may not have come into contact with narcotics or Xanax or a similar situation. They can share their story and the consequences that they're currently facing as a result of their substance abuse.
And so these kids are doing this as a role-playing situation.
Yeah.
Will every student be given a scenario, or is it that group that gets that scenario and they all have to go through it the same?
It is a group, but there are 9 different scenarios. Okay. So, as Donna said, they're going to be broken up into 9 different groups, and then whenever they all come together, then they'll be able to discuss different scenarios of what everybody else went through too.
Okay. And when will this be held?
The event is on next Thursday, October the 17th. It'll be all afternoon. I think we start with the students around 12:30. They'll be taking a pre-test. We want to know what their level of knowledge is right now. So those tests have been taken to the schools, and the kids will be taking those. Then they'll go through this. We'll have a little warm-up for them and a debrief as well with their teachers. And then we'll do a post-test in a couple of weeks and see how their level of understanding has changed. So, like I said, it'll encompass at least half the day for the students.
Okay, and so this is Thursday the 17th.
Right.
Other schools that might want to become involved, who should they contact? What do they do? Or have they been contacted now? It's just kind of wait and see how this works.
Well, all the schools are, like I said earlier, are part of the partnership. And so we always report back to that larger group about some of the activities that are going on. And so if this is successful, which we absolutely believe it will be, we will take our idea out to the other superintendents. We have school nurses that already sit on our committee, so they'll be hearing about it, and then that is our link into the schools. So, and I think the schools network, I know the principals network and the superintendents all network together, so we're hoping that that information gets carried from Southridge to the other schools as well.
And, a really important factor in kids' lives is parents. So how do you hope this filters to parents?
I'm glad you brought that up, because whenever I do talk to some of our clients, at least one thing gets brought up is that they were either using whenever they were young with their parents did not care that they were using, or they didn't know, and they didn't know how to talk to their parents about it. So you're right, it is so important. Originally, this program was developed to include parents, and since this is a pilot for us right now, we're trying to make it as small scale as possible to make sure that it is successful. What we would like to see in the future, though, is a parent event following the student event where we can report our results, and then also maybe just have some guest speakers as well, and a discussion or a panel between the actual community professionals that are coming in and delivering the consequences.
I guess you get a lot of volunteers to put this together. It doesn't just happen with just a few people.
Oh,
How many
absolutely
people are
not.
helping with it?
We have a great selection of people, and Megan and Jane Chappell have done a lot of work at getting those community partners to come in. Like we said, we've got a judge, we've got the sheriff, we've got CASA workers, we have substance abuse people, we have, the list goes on and on. I can read them. We got community corrections, the Central Christian Church, Southern Hills. Of course, the school will have their representatives there because they have their own workers in-house. So there's going to be a wide variety of community partners that the kids will actually get to meet, and we think that's really important, that we aren't going to be the ones sitting there role-playing like we're the judge. The actual judge is going to be sitting there, and the actual sheriff will be sitting there. I think that will create a real impact for the kids at that age.
Much more realistic.
Absolutely.
It's easier for them to give the right kind of answers.
Right.
Because they see it firsthand. So.
Absolutely.
Right.
Well, anything you ladies would like to add?
Just we're real excited about the opportunity. We'll be happy to report back to the community about how the project goes. And if there are other ideas that people think there are really needs for these kind of programs, please give that feedback to me at the health department, and I will carry that to the partnership, and we'll try to continue to provide the best programs we can.
Well, ladies, thank you very much for being our guests.
Thank you
Thank
for
you.
having us.
Our guests have been Donna Oeding, the director of the Dubois County Health Department, and Megan Durlauf, who is the treatment programs facilitator. Thank you very much for watching WJTS in.form. We are local people watching local people.